So, quick disclaimer, this is not a operating theater. This is not a place where you would normally be able to do a surgical scrub. If you had a facility where you were expected to scrub in for procedures, you would have, first of all, you would have a sink that was actuated either by foot, by your knee, or by motion. You cannot do a proper surgical scrub on a sink where you have to touch the handle. But that's what we have, so I want to show you the rest of it, just that quick disclaimer. Also, a word about all of this pickiness that we have about, you know, to scrub. You might think, oh, why do I have to every fingernail, all this stuff? It's because hospital infections, hospital-acquired infections, healthcare-acquired infections are epidemic proportions. These organisms continue to adapt, they continue to be more resistant to different drugs, and they hide. They hide in all kinds of places, and so we have to be really as careful as we possibly can. And so we've standardized this procedure to make it as careful as possible. So I'm going to show you how to scrub in, and then I'll show you in the next video how to gown up. So what we're going to do is we're going to have the scrub, and then we're going to move over to the back table where we have our gown and glove, and then we'll gown and glove up on that. But just for the scrub. So you'll have something like this. Usually they're iodine based or possibly chlorhexidine based. Just make sure that if you have a skin reaction to this, and if you're working where you're going to have to scrub a lot, make sure that you have something available that doesn't bother your skin. Okay, step one, get rid of all your jewelry. I'm going to put a bunch of paper towels on the floor before I start, because I don't want to slip.
Right.
If I slip, guess what? I have to start over. If I touch anything, I have to start over. So starting with the sponge, inside you have a scrubbing sponge, and it has a scrubby side and has a sponge side, and then it has this little stick. It's blue. This one's blue, but sometimes it's called a green stick. This is for cleaning on your fingernails. So you get your water going, and you want to just get yourself wet a little bit. Soak up the sponge. Get the sponge really saturated with water, and you just want to, right? So my sponge is nice and wet. So the first thing I'm going to do is clean out my fingernails. If you have long, fancy nails, forget it. You're not going to be able to do your job. You have to have short nails. And that's what this little guy is for. So under the running water, I'm going to work it underneath each nail like that, scooping out anything that's under that nail, under that water. Like that. Bacteria can hide, and we want to find it where it's hiding. Okay, so that's my left hand, so I'm going to do the same thing with my right hand. Scoop out each fingernail. When I'm done with my right hand, I'm done with that. I'm just going to drop it. I'm not going to pick it up again, it's gone. Okay, anything that I drop from this point on is going to be gone. Can't touch it. If I accidentally touch the sink, if I accidentally touch the cabinet, if I fall down on my butt, guess what? I got to start over. Okay, so now it's the scrub part, right? So I've got my soap, soapy soap. So I'll start with my fingertips. I'm going to scrub my fingertips 10 times each side on the scrubby side. Okay, now I'll just start with my left hand. You can start with your right, whatever. Each finger has 4 sides. 10 scrubs for each side. There's 4 sides, but there's 10 scrubs for each side. So 4 sides on your finger, 10 scrubs for each side on the finger, so that would be 40 scrubs for every finger
40 scrubs for the hand, 40 scrubs for the first half of the arm, 40 scrubs for the second half of the arm. Just like that.
Right, so I'll start with my thumb. Okay, index finger. So that's 4, and I'm going to go 4, 4, 4, okay? And then now my hand has 4 sides too. So actually when you do your hand, start with the palm. Sorry. Okay, so this hand's all done, and I'm going to go over and do this hand the same exact way. 40, 40, 40, 40, 40, right? And then 40, okay? Now I'm going to do my arm. I'm going to soak up my arm again. My arm gets divided into, each arm gets divided into, so I'm going to go from here to here, here to here, then here to here, then here to here. Same thing, 4 sides. Then the other side, and then all the way to my elbow. At this point, I really want to make sure to keep my hands above my waist. And I'm going to be keeping my hands above my waist from this point on, all the way into the procedure. And then I'm going to do this arm. Okay, now I'm all scrubbed. I can drop that. If I pick it up, got to start over. If I bump it in the cabinet, I got to start over. If I scratch my nose, I got to start over. Okay, so now I'm all soapy, I'm all scrubbed, I got to rinse. Okay, and rinsing is one sweeping motion, not back and forth, but one sweeping motion, right? And I can rub with my fingers a little bit. I want to go slow just to get all that soap off. Okay. One sweeping motion of the hand. Same thing. Okay, so now I'm all drippy, and I'm going to go over to my back table, I'm going to towel off, and I'm going to gown and glove. But there's something important to remember when I go over to my back table, and then so I don't want to drip all over my sterile stuff, because am I sterile? No, I'm not. There's bacteria that lives on my skin all the time, even now. I'm as clean as I can get. And I'll be donning sterile equipment on top of it. This is about being as clean as possible, even underneath all of your sterile stuff. Right? So I'm dipping off. I'm going to move over to my back table, and I'll show you in the next video toweling off and gowning and gloving and donning that stuff. This is equally as important because I'm not sterile, right? But I'm very clean.
And one thing you might notice is I'm not wearing a surgical cap. We don't have them at our school, but that is another essential for any operating theater, to cover your hair and cover your head.
Remember to keep your hands up and dripping off from the elbow. The medical hand wash we drip off from the fingertips. The surgical scrub we drip off from the elbow.